You will now have the opportunity to practice what you have learned, using an actual case study. Ikram is 10 days old. His weight is 3 kilograms. His auxiliary temperature is 35.7 degrees Celsius. Ikram has been brought to the clinic by his mother because he is sick. First, check for very severe disease and local bacterial infection. Ask, is Ikram having difficulty in feeding? The mother says, yes, Ikram was feeding well earlier, but has not been feeding well for the last 2 days. Has Ikram had convulsions? The mother says, no. Count the breaths in 1 minute. Prepare to start counting. Start counting now. Stop counting. How many breaths did you count? Write down your answer. Repeat the count if you decided it was elevated. Next, look for severe chest indrawing. Does Ikram have severe chest indrawing? Write down your answer. Measure temperature. Ikram's temperature is 35.7 degrees Celsius. Look at the umbilicus. Is it red or draining pus? Look for skin pustules. Write down your answer. Look at Ikram's movements. Does he move on his own? Write down what you decide. That completes the check for very severe disease and local bacterial infection. You should now classify Ikram. Now, assess Ikram for jaundice. What did you decide? Does Ikram have jaundice? Does he have severe jaundice? You should now classify Ikram for jaundice. Then ask, does Ikram have diarrhea? The mother says, yes. For how long? The mother says, Ikram has had diarrhea for 4 days. Look at the young infant's general condition. You have already assessed Ikram for movements when checking for signs of very severe disease. Now look to see if he is restless and irritable. What did you decide? Write down your answer. Look for sunken eyes. Are Ikram's eyes sunken? Pinch the skin of the abdomen. Does it go back very slowly, taking longer than 2 seconds? Does it go back slowly? That completes the assessment for diarrhea. Now classify Ikram for diarrhea. We will then tell you how we classified Ikram for very severe disease, local bacterial infection, jaundice and diarrhea. We will now tell you how we classified Ikram's illness. Ikram is 10 days old. He has been brought to the clinic by his mother because he is sick. We checked Ikram for very severe disease. Ikram has had difficulty feeding. The mother said Ikram was feeding well earlier, but has not been feeding well for the last 2 days. Ikram has not had convulsions. We counted the breaths in 1 minute. We counted 44 breaths in 1 minute. Ikram does not have fast breathing. As Ikram was taking less than 60 breaths per minute, we did not repeat the count. Next, we looked for severe chest indrawing. We decided that Ikram has severe chest indrawing. Ikram does not have a fever or very low body temperature. His temperature is 35.7 degrees Celsius. The umbilicus is not red or draining pus. Ikram does not have skin pustules. We decided that Ikram was moving spontaneously. You had seen Ikram moving on his own during the assessment. We looked at the pink section of the very severe disease and local bacterial infection chart. Ikram's signs of not feeding well and severe chest indrawing classifies him as very severe disease. Next, we assessed Ikram for jaundice. He did not have any of the signs of jaundice. Next, we assessed Ikram for diarrhea. Ikram's mother told us that Ikram has had diarrhea for 4 days. We looked at the child's general condition and decided that Ikram moved on his own during the assessment. Ikram's eyes were not sunken. When the skin of the abdomen was pinched, it went back quickly. Look at the pink row of the classification table. Ikram's mother told us that Ikram has had diarrhea for 4 days. However, he has none of the signs of severe or some dehydration. Therefore, we classified Ikram as no dehydration. Ikram's signs of not feeding well and severe chest indrawing classifies him as very severe disease. He has none of the signs of jaundice. He has diarrhea with no dehydration.